Thank you very much, Joanne. Lovely to see you again. And thank you to all of you for having me come to speak. I'm Ann Wyman. I'm a senior partner at African-Vest. For those of you who don't know us, African-Vest is a Pan-African investment platform. We have strategies that range from private equity to venture capital to debt, and we're present across the African continent. I'm actually speaking to you now from Tunisia. I might be the only Africa-based person today in the room, but lovely to be joining you. Like has been mentioned previously, I think for those who are investing in Africa, like ourselves, like Runa and others, being a part of the 2X challenge is kind of an important element in what we do, being focused on promoting female entrepreneurs, ourselves being gender balanced as an investor, and being focused on women. But I do want to spend a little bit of time today to talk about the partnerships that you talked about, Joanne, and how important those are to us in all of our strategies, but in particular, one that has already been mentioned by my colleague from USAID, which African-Vest and the Health Finance Coalition are leading, and we're very excited to have announced yesterday at the White House, which is the Transform Health Fund. And this is actually a blended finance vehicle. We are grateful for commitments that have already been made from a variety of different LPs and investors into that fund. These will be both DFIs, so whether it's DFC, SWED Fund, USAID, but also then commercial and investors such as Philips and Merck. And then we also have a number of family offices. These are all coming together in, I think, in an innovative structure that allows us to really invest in health system resilience across the continent, and particularly in vulnerable communities, and especially in women and children. It's a female-led fund, which I think is also important, women investing in women, and it has quite a number of companies in its pipeline that are female focused as well. So this trickle down to the end investment, we have in our pipeline, for example, a digital mass market retail platform for women's health and self-care products that is increasing access and affordability. We have also a hospital in Kenya that is focused on maternal and child care. And we have a network of low-cost primary care clinics with a focus on women and children's health. And those are just a sampling of the kind of investments that we'll be able to make because of this partnership that we are so lucky to be engaging in with people who are coming together. I think in particular, recognizing that what is required to get these kind of investments done is an understanding that the returns in the near term are not likely to be exceptionally high. That requires catalytic money to come in and start to provide some of the support for others to then create an investable product that will then have more of a crowd-in effect. So we're very grateful for all the partners who are coming together for this effort, which is going to allow us to support health, but also importantly to support women and children. I'm going to leave it there, Joanne, and then if there are questions about the fund, of course, we can answer them at a later point.